Dry eye is something that affects millions of Americans, and the biggest concern with dry eye is oftentimes people don't know they have it, or they don't know they have the early warning signs of dry eye that's likely to progress into something that is symptomatic and affects their daily quality of life. Dry eye symptoms can include things that not only make your eyes feel dry, but sometimes it feels like there's something in your eye, or you wake up in the mornings and you have a little mattery or goopiness to your eyes. You feel like the need to rub your eyes, or even have fluctuating vision where sometimes it's blurry and sometimes it's clear. All of those symptoms indicate an irregularity on the front surface of the eye that is very common to dry eye and can be very frustrating for many patients as they don't necessarily understand what's happening with their eyes or their vision. Causes of dry eye include excess screen or digital device usage. Some people have predisposing medical conditions that may make them more likely to develop dry eye, such as autoimmune disorders or even things like diabetes. And sometimes there's just a hereditary or family history of dry eye that may also increase the risk factors for developing. If left untreated, dry eye is something that will usually progress and become worse over time. This can cause problems with not only your daily comfort of your eyes and your overall clarity in your vision, but can make things like eye surgeries be less predictable and your healing to be less predictable. It can make contact lens wear much more uncomfortable, which is something that we like to address with all of our patients, as we would like to keep you in contact lenses for vision correction as long as you would like to be in them. By helping to manage and prevent that dry eye from continuing to get worse, we're going to enhance and overall give you more options for your vision and things you can do with it, and keeping yourself comfortable and clear for your entire life. Dry eye can really affect anyone at any age, and so we here at Complete Eye Care actively screen for and monitor your eye health for dry eye signs or symptoms. We're evaluating your oils in your tear film and the function of the oil glands that are in your eyelids as they feed into the tear film. Clogging of these oil glands, which are referred to as meibomian glands, is at the root of about 75 to 85% of most Americans' dry eye. So if we can effectively manage normal function, we can prevent issues and problems from continuing to occur. If someone has dry eye, we are giving them a variety of options and opportunities to treat that dry eye or manage it in a much more effective way. Typically, we'll start with and recommend home therapies, simple regimens that can be introduced into your daily life. More advanced treatment options for dry eye include several in-office therapies we have here at Complete Eye Care. The first therapy is called LipiFlow. LipiFlow is an on-eye applicator that warms the eyelids and helps liquefy all of those clogged gland contents I was referring to. This liquefaction of the oils and then a gentle massage to move those oils out allow those glands to return to normal function and rebuild those oils back up so that they remain unclogged with management by us and you at home with our treatment that we recommend. An additional therapy that is complementary to LipiFlow is called intense pulse light therapy. Tilt your head to the side a little bit. This therapy targets the skin in the cheeks and the nose and helps reduce the blood vessels that are feeding into the lower eyelids and are inflamed and irritated and contributing to further clogging. The intense pulse light therapy has been around for many years in dermatology to improve skin tone and appearance. We've discovered through many years of research these dry eye benefits that also occur with this therapy. Patient feedback from these treatments is extremely positive here at our office. We monitor your symptoms not only by talking to you, but also by doing consistent surveys that help us to know the level and the degree to which you're noticing the many symptoms of dry eye. In my experience, I typically see that symptoms can be cut in half, if not more, by many of these treatments. But my goal, and our goal here at Complete Eye Care, is to always manage this before it becomes a highly symptomatic issue or problem. Once we've reduced potential symptoms and issues, our job is to continue to manage them so that you can maintain a very comfortable visual performance every day without thinking about your eyes and your vision, as long as we're keeping everything healthy and working as it should.